And now we're going to turn to Brad Reedy, Dr. Brad Reedy, who's a partner and director of clinical services at Second Nature Therapeutic Wilderness Program. And he is writing a book, which I'll be publishing, called The Journey of the Heroic Parent. He knows a lot about what children go through, what parents go through, and has dealt a lot with young people suffering from depression and suicidal ideations and so on. So a warm welcome to Dr. Brad Reedy. Hi, Brad.
Hi, Judith. Thanks for having me on today.
So what are your impressions of the Robin Williams situation?
You know, first and foremost, I think the most important thing to note about it is it's not a simple question and not a simple solution, that it's complex. And I think all the simplicity that people try to use, and they're just trying to make sense out of it, I think it's a part of the problem. We think about it as a very simple problem and a very simple solution. And I was talking to some friends about it, and we were talking about, the depression or the addiction, or is it the depression and the addiction? And my thought about it is, and I think everybody knows this, they just don't have the word for it, is the thing that caused the suicide was shame. That's the thing that addiction shares with, depression shares with all of this, and it's the thing that everybody's trying to bypass when they're saying, reach out for help, ask for help. And so shame is the real killer here, I think, in situations like this.
So how do we, somebody like Robin Williams, he's famous, he's successful, he's talented. To other people, we look at him and we say, oh, he has so much. And yet the pain, the suffering, and sometimes people who have these amazing lives also seem to suffer in a greater way from shame because they have to isolate even more because they set foot out of that, and any little thing that they do is on the world stage.
Right.
That must make it even more difficult to treat.
Right. It's kind of an exaggeration of everybody's life. And the message of, what could he have to be depressed about, or what was his problem, that is the message of shame. That's the lack of understanding. And understanding is the imperative. When somebody says to a child, you should feel happy or you should feel something else, they're saying block out your feelings, which is really what depression is. And self-medicating and addiction is. It's this, I don't want to feel things. So all these cultural messages that we have, the antidote is listening, understanding and finding out who Robin, or for that matter, anybody is part of the cure, is part of the solution. And it's really a cultural and a family issue. It's not about Robin Williams. It's about the kinds of discussions and relationships that we have in our families when we allow ourselves and other people to feel sadness, to feel pain. And the people that are feeling it, they get to decide what they're feeling. We don't get to decide for them. And I think this lack of what was he going through, how could he do this, I think that's part of the message that the people that are struggling with, they say, well, I can't come out with this because everybody tells me that I'm crazy or wrong or stupid for feeling what I'm feeling, but I know I'm feeling it, so there's nowhere to go.
So, and that's a very important point to make, so thank you. The stigma of mental illness in our culture. Talk to me about that, because there is a stigma.
Yeah. And people don't even know that they have the stigma. I work with families who have children that are struggling with addiction and mental health issues, and they say, I don't want to talk about this with my friends because I'm worried that my son or daughter will feel ashamed of it. But as we tease that out, it's part of their own shame.
Exactly.
It's part of this thing that I have to have it all together. I have to have the answers. And the interesting thing for our children and people that suffer, they don't want somebody who has all the answers. They want somebody who's vulnerable, who doesn't know. And that makes them feel connected, that they can relate to, that they can open up to. But if you have all the answers, and if you have to put on this nice veneer, this nice mask that looks like you have it all together, I don't feel safe with you because I don't have it figured out, so something must be fundamentally wrong with me.
So you have people who come into the wilderness program. You run a therapeutic wilderness program. They're young people very often who are suffering from depression, who might have had suicidal ideations. Their families don't know what to do. What happens when they come to your program? How do they get better? How do you treat them?
I have two thoughts about that. Obviously, you want to look at genetics. You want to look at the brain disease of depression and addiction and other mental health issues, and you want to respect that and understand that the medical intervention is an important part of this. You're also using typical therapies like dialectical behavior therapy, where you're teaching them to be mindful of things and teaching them skills to overcome it. But I think there's two philosophical things that I want to say about it. And the first thing that I say to them, that we say to them, is part of you does need to die, but not all of you. You're confused about that, and it makes sense, but there's a part of you. It could be In anyone's case, it could be what people think about me. It could be what I have to live up to. It could be the shoulds and the ought tos that I live with, or making somebody else happy, or making a certain amount of money, or looking a certain way. That part of you does need to die. So we talk about how we can help them to let go of those parts of them that are keeping them feeling in prison, keeping them feeling like there's no way out, because I can't be this thing that I am, or I can't feel this thing that I feel. So that's a part of it, and mostly, and I think I heard it in your previous segment, is we've got to be with them non-judgmentally. We've got to say, we're going to sit with you, and you're allowed to feel and think what you feel and think, and you don't have to discard any part of yourself for me. You don't have to go away. You don't have to hide something that I find offensive and scary. It gets to be here. And then they start to make sense out of themselves. They start to understand, okay, there's parts that I've taken in, there's judgments that I've internalized that I think come from me, that I think are mine, then they're not. You weren't born with those. So we help them to get rid of the parts that aren't them, and we help them to embrace the parts that are them, and we embrace that. We create this safe container for them. And then you overlay these therapies and the medication and the exercise and the diet and the sleeping all on top of that, and the mood tends to lift.
And what happens, I know you work, very much with young people and their parents. What happens when you bring parents into the equation? Because you've worked with young people, you bring them to a point, a lot of teenagers, where these mood situations first emerge. A lot of depression emerges during the teen years or even preteen years. What happens when the parents come in? Because, then we have a whole other thing to deal with.
Yeah, I think they mostly, like with most adolescent and young adult programs, the idea is I'm sending my child to you to fix them.
Right.
And, of course, we accept that entry point. We accept the idea that that's the premise that we're starting this process out with. But really what we say is this is a systemic problem. And the depression is this symbol, this crystallization of the systemic problem, much like a person like Robin Williams' diseases and suicide are part of a symbol of or a symptom of a society, right? A society and a problem that we have. So we start to intervene with the family. We teach them how to sit with their own feelings. We teach them how to listen to their children. Most parents, when they walk in the door, they say, I listen to my children. I can do that. I'm a good listener. And as they progress, they realize how difficult it is to really listen, to just be with somebody. We want to talk them out of their feelings. We want to tell them to look on the bright side. We want to tell them to practice gratitude right away. We want to tell them that if they just look at it differently, they won't be upset. And we talk to parents and say, the first rule is just keep your mouth closed and listen and understand. Understand and seek after understanding with your child, because when you find them, when you can listen to them, when you can sit with them, they can access their own resources and they can start to heal themselves. But when they think that they have to be something for you because, Mom, you're uncomfortable, that I'm struggling, and so you want that to go away in me, so I can't win, you see, because I either have to hide what I really am feeling and what I really am, which makes me miserable, or I feel it and it makes my mom miserable, which makes me feel like I did something wrong, that something about me is bad or unacceptable. So we teach families to create a safe place, to create a non-judgmental place. And I'll say something else that I think is really, really critical. We change the measurement from a moral failing to a brain problem or a disease or a trauma. And when parents can stop thinking about it as you're doing the wrong thing, you're taking drugs, you're cutting on yourself, you're hurting people, and when they can see that it comes from a place of trauma and when it comes from a place of chemistry, they change their whole perspective and view of the child to this non-judgmental place where they're just there to help them heal them, because these behaviors, all of these mental health behaviors, are just evidence of pain and trauma. And when parents can see that, again, they start to access a resourcefulness in them that's very different from when they were looking at it as a moral failing.
What do you say to people? What would you say, for instance, to Robin Williams' daughter, Zelda, who's written this very beautiful thing, I love you, I miss you, I'll try to keep looking up. And she posted a very beautiful quote from Antoine de Saint-Exupéry. You alone will have the stars as no one else has them. In one of the stars I shall be living. In one of them I shall be laughing. And so it will be as if all the stars were laughing. When you look at the sky at night, only you will have stars that can laugh. She says, I love you, I miss you, I'll try to keep looking up. So when somebody like Zelda Williams, who's just lost her father to this tragic suicide, comes into your program, what would you say to a child like that?
I know this sounds like almost like sounds too simple, but I think the process is I would say very little and I would listen, and I would just ask questions. She needs to tell me. She needs to feel the pain, and most likely I would feel some kind of empathic pain myself, and I might even share some experiences of loss or pain that I've had, but I would in no way try to tell her that I had it all figured out. But the key is they don't need to be told something. They need to be listened to and understood. And there is no way around grieving and pain and loss except for through it, because every other way, including me trying to talk them out of it, would be to say, take this part and make it go away, and that's what creates depression. Depression is not pain. Depression is the solution in the psyche and in the brain to mitigate or to stifle the pain. And so my job as a therapist is not to take pain away from people, but to facilitate them feeling through it and going through it. So I would listen.
You know, it's so important, the information you have, which is, of course, why I'm so excited to be publishing your book, Dr. Brad Reedy. And you always give such a fresh perspective and such insight into everything. And I just want to thank you for being here tonight, Dr. Brad Reedy, who's a partner and director of clinical services, the Second Nature Therapeutic Wilderness Programs. Thank you so much.
Thanks, Judith.